There's a famous saying in science that nothing about biology makes sense except in light of evolution. Well, with my experiences with pain, and this picture is of me from actually about 10 to 12 years ago, when I was in the midst of many, many, many years of chronic pain, nothing made sense to me. Stretching, strengthening, I was already strong, I was already stretching, I tried all of that, and nothing was working because I wasn't seeing that bodily pain, and there was no injury, just pain. I wasn't seeing it in the context that postural restoration provides, which is that musculoskeletal pain and joint pain and neck and body tension has to be seen in the light of walking and breathing, our original two movements. If you can't see it in that context, then the pain is very mysterious. But once you can understand walking and breathing are our two adult human movements that we don't have to learn how to do, it's just built into us, and they can't be separated. Once you can put it in that context, your back pain can really be quite well understood. The most obvious demonstration of our asymmetric build is in the diaphragms. With my last video, a lot of people were surprised to find out, or to learn for the first time, that our right diaphragm, that we have two diaphragms, it's not just one. This is our primary breathing muscle, plural, muscles. The right side and the left side, they are two separate muscles, and the right side is much bigger. And because of the bigger right diaphragm, and the diaphragms attach underneath the front of the rib cage and then in the lumbar spine, as you see in this diagram, because of that, the forces generated upon the spine in a rotational and side bending movement are stronger to the right than they are to the left. So you could think of it this way. If I told you that you had 10% more core musculature on the right side than the left side, would that make you rethink your workouts and how you move? It probably would. It's just never considered. As I'm standing there in a neutral spine, what I'll call a neutral spine, and this diagram is from one of the postural restoration manuals, you'll see that the diaphragm is in a domed shape. The dome shape allows it to go down and up. It allows it to pump as the primary breathing muscle. That's called a neutral spine. Most people, the gentleman that you're going to see, is not in that position. He's in this PEC pattern, pelvis forward, ribs up. He's lost his diaphragms, and that's why his ranges of motion are limited. But once he can get that diaphragm into this dome position, but let me just show you what it would look like in a non-neutral position. So this is the extended spine. Now, if you look at how I'm standing, I'm arching my back and bringing my head forward because that's kind of what happens. In this position, when the ribs are flared up, the diaphragm is flattened. It no longer has its dome, and if it's flattened, it can't move down and up, so you can't really use your diaphragms on one or both sides. Usually, because of this asymmetry, the left side becomes less of a breathing muscle and more of a postural muscle, while the right side will retain its ability to stay domed and pump, also because it has that big liver underneath to support it. But in the PEC pattern, when you're bilateral, the right diaphragm also loses its ability to pump to one degree or another. So what I'm going to show you now is a video of a client who actually just came in yesterday. And he was a perfect person to fit this video. I actually had this video planned before he came in, but nonetheless, I'm going to just walk you through what you're going to see. First, and it's very sped up because it's very sped up because otherwise it would be 6 minutes long, and I know no one wants to sit and watch that. First, you're going to see the testing where neither leg will adduct, and then you'll see that neither leg will internally rotate. I'm sorry, neither shoulder will internally rotate. He's in this PEC pattern that I was talking about. Then you're going to see me have him blow up a balloon in a particular position, and you will see how all of these range of motion tests change with no stretching, nothing aside from getting him to breathe in the proper position, which allowed him to regain diaphragmatic ability. So here you go. So here's his right leg. It does not adduct, so we know that his right leg, his right hip flexors are overactive, keeping the pelvis forward on that right side. But his left side obviously is going to be forward also because that's normal asymmetry. So the left side also does not adduct, and it's actually stiffer than the right side. So both of his hip flexors, psoas, are overactive. Now you're going to see his left shoulder does not internally rotate. I'm just trying to position him so you can see it. His left shoulder does not internally rotate. And now his right shoulder also does not internally rotate. Okay, now the video speeds up. And there we go. So I'm just setting the camera. So I'm just showing that I'm not changing. I'm not doing any tricks here. The camera stays on. I'm just putting him on a box, and then I'll straighten out the camera. And I am teaching him how to blow up a balloon properly. And I've made videos on this, the best vagus nerve exercise. I talk about how to do this. Now I round his back. I'm putting him in flexion, one breath in the proper position. He can now adduct. His hip flexors are off on the right side. His hip flexors are off on the left side. His left shoulder now internally rotates, no problem. And his right shoulder also internally rotates with no problem. So there you go. That was one. I taught him how to blow up a balloon and make sure his tongue remained up against the roof of his mouth, so to prevent the air from going back in. And then I put him in the proper position. And the moment he took one inhalation, what did I see? I saw, because remember, his back was like this. When I put him in a flexed position, it rounded his back. It gave his diaphragms, plural, a position that they could get into, which would retain a dome or would put the dome back into the diaphragm. We had to put that body from here, extension, into a state of flexion, which positioned his hip flexors to turn off as long as he could use his diaphragms. And with one breath in, I told him to stop after one breath. Why? Because I saw his back expand backwards. When you're extended, you cannot expand your back. Because all you're doing is pulling your rib cage up, up, up with your neck. And once I saw that, I knew immediately. I stopped him after one breath and he was neutral. Now, he was a great test case because he had no pathology. Now, this is where it gets more complicated. That's why this technique, I cannot say this technique will work for every single person. For some reason, that makes people angry because they think there should be one exercise or one technique that works for every single person. That is not the case. He had no pathology. And what you're going to see here, the two places where pathology or weakness or excessive range of motion, instability occur most frequently with individuals who are in this pattern, which is basically everybody that comes to see me, is in the front of the left hip. So in the front of the left hip, the anterior ligaments are usually stretched out. That's because of the position the pelvis and the femur have been in for so long has stretched out those ligaments, so people lose stability in the front of the left hip. That's not, at least I would say, not 85 to 90% of people who come to see me for pain have that front hip on the left that is unstable. Another area could be in the right iliolumbar area. So the area of the back of the right part of the pelvis that attaches to the lower lumbar vertebrae, that can often be stretched out also. So if there's areas of instability, those two areas of instability, if he had those, I would not do that technique with him. Probably I would do the technique that I'm going to show, but also because that instability that's built in makes it more difficult to breathe without using the wrong muscles. When you're completely intact, when you're still structurally stable but in a pattern, everything, you respond to everything. These types of clients, patients, whatever you want to call them, they make us look like geniuses because as long as you put them in the right position and have them breathe, things will work. But people with instability, and most people, if you're in pain and you're watching this video, and even if you're not in pain, and you're over the age of 18 or 19, or in your 20s, 30s, 40s and up, highly likely that at least your left hip will be unstable. And the more instability there is in that left side, because remember, you have less core muscle on the left side, and the pattern puts us over on our right side, so we become very unstable on the left because we're never there appropriately. The more instability on that left hip, the more you have to tighten up in other areas of your body to stabilize you. But you have to get those areas to relax so you can stabilize the left hip, and that's where the science of postural restoration really comes in. If you're still with me and you like this video, could you please like it, comment, share, or subscribe to the channel? I would appreciate it. Thanks. Okay, so here I am, set myself up. My back is against the wall. There's a towel between my thighs, and as I squeeze that towel, it helps. A lot of people who are in this forward position, they have a tightness in the back. So squeezing the towel will help bring the pelvis in the right position and also stretch anything in the back. You can also put just a normal ball between the knees, and this is what it looks like from the side. I'm just in that position, and I'm breathing, and I'm sensing my back move back against the wall. The less movement you see, the better. All I'm sensing, because I don't need it really, but my pelvis is tilted back, my spine, my lower back is flat, and what you also see is the front of my chest is expanding forward as I take a breath in. So the upper chest expands forward, the middle back extends backwards, and that's overall expansion. What I'm not doing is this. That is neck breathing. If you take a breath in and your shoulders go up, that's not going to work. It's not going to work. And I'm also not arching my back when I take a breath in. Those are the two things that people will mess up with. As long as you stay in the position that I was showing, you might have to watch the video again, as long as you stay in that position and breathe, and you're going to sense the ground underneath your left heel and the right arch, you will inhibit, most likely, again, some people will have neck issues where their neck is so tight that it won't let go, and this may not work. And again, not every PRI technique is perfect for every single person. That's why you really need to see somebody in person and not just try to do it on your own, because you don't know if you have pathology. You won't know unless someone tests you, and there's no way for you to know unless someone does test you.